Good evening. What's going on?
I'm back.
Yeah, you're back. How you been?
You know what? I'm glad to be back. I'm good, thank you. But
It's good
you
to
know,
have you back.
yeah, thank you,
Yeah, you're looking nice and toned up and ting.
thank you. You know that even skin tone that comes with a vitamin D sunshine. Yeah,
All right. So I'm Novelist,
and I am Jewel.
and we'll be right back.
So I'm Janine Xavier Cross. I'm Janelle Xavier. And where's Xavier Street?
Yourself, this is what you beat on the inside and we're ready to go.
Are you, Jewel? I think
No,
you
I'm
have hidden talents that you're not talking about.
I just get at the bar. Ain't no bar, Mr. Drum.
Yeah.
I can honestly say that they've done such a good job with hospitality and welcoming all people in.
Well, Samantha Moon.
So my name is Claudette. Alona Peters.
I am Selena.
And then that's how it started. When I came home,
My name is Pumba. Stage name, of course.
Well, I was born in Spanish Town, Jamaica.
I am Evelina Blanc.
I am a mother first. I think I'm a really wonderful friend. I'm a really great business.
I gotta be ready because you're like, oh, she picked that. No, I didn't.
Yep. I am Kendra Stephen.
I am Rena Charles, aka Mystery.
People forward in victory.
Welcome back to Dissect. So, Jules, we allowed to talk about, you know, where you've
my
been.
my trip. Yes, we can talk about where I've been. Yes.
Left me all stranded and stuff.
Yeah.
So, how was vacation, man?
My vacation was amazing. I am Canadian born, so being in the Caribbean, I was in Jamaica. Being in the Caribbean, the mosquitoes were swarming me and they were biting me up. But by the end of my trip, I was ready to go home.
Yeah.
Yeah. As much as I love the sunshine, the heat, I was ready to come back.
Mosquitoes run you out, you're saying?
Mm-hmm.
Yeah, I know that feeling. That's a sacrifice, man. You got to pay. So,
Yeah.
well, welcome back. And, the last 2 weeks was different without you. You know what I mean? So,
Thank you.
yeah,
I missed
definitely
you too.
last week's show. So, yeah. Well, it's good to have you back. And we have a lovely guest joining us tonight as well.
Yeah, tonight we have it's kind of one of those shows where we talk about us as Afro Caribbean, and we're gonna just talk about not mental health, but wellness, our physical health and wellness. And I think it's important to talk about that stuff. So we decided, Novelist and I decided to bring on a nurse practitioner to explain to us what we need to be doing to take care of ourselves to make sure we maintain our health. And without further ado, I will introduce her, and her name is Nurse Kavita.
Hi.
Hey, welcome.
Welcome. Welcome.
Thank you.
How's everything?
Not bad, take it day by day. It's not so bad.
Enjoying our cold front out here in Canada.
Absolutely not. Definitely not. But we get through it. But April soon comes, so hopefully shorter winter. Not a lot of those.
Nice. So, tell us, I guess, a little bit about yourself. I'll, I guess, point out where you're from. I guess, what do you do? That type of thing.
So I was born in Canada, but my background is Indian and Jamaican. I am a nurse practitioner. I'm working in a NP-led clinic in Toronto. Previous to that, I was an NICU nurse and a pediatric nurse, and I also worked in cardiology. So I have quite a bit of nursing experience. I know Jewel from other jobs within the city, and we're friends too. So thank you for having me on. It's an honor, and looking forward to it, I guess.
Yeah, well, thank you for joining us. It's a pleasure to have you with us this evening. So,
Thank you.
Absolutely. I guess our goal with bringing you on tonight. So our goal, like I said, as we introduced you, was to talk about us and what are the factors that affect us as Afro people, African heritage, or from the diaspora. Things health-wise that we need to think about, maybe checkups that we need to have, maybe even foods, if different dietary needs that we need to think about. But well, let's kind of leave it open. We're not gonna box you into any corner. We'll leave it really wide open. So it's an hour of discussion, and there's lots to explore and talk about. So now let's.
Sorry, go ahead.
yeah, no, if you're going to say something, go ahead.
Go ahead.
No, I think she was bunting to you, so it's all good. Go ahead.
Okay. So what made you want to study medicine? Is it something that, you always wanted to do, or did you spark interest later, like maybe as a teenager, or what brought that along?
So both my parents are nurses, so it was kind of, I don't want to say in my genes, but kind of geared towards. I'm sure my mom would have loved if I became an MD, but I'm enjoying being an NP. There are differences in the role between a physician and a nurse practitioner. What made me want to do it? I didn't have the patience to be a teacher, but there's some teaching involved, which I do enjoy, and it's just that connection. I remember when I was working at the bedside, it was more so you would come, and it was very episodic in the sense that you see them for maybe a few days while they're in hospital, and then they're discharged home. And if they're lucky or you're lucky, you never see them again, right? Because you don't want them to come to the hospital. But I wanted to kind of follow my patients, like see if they got better, and especially in my area as a pediatric and NICU nurse, it's their babies or children. You kind of want to see them grow, which is kind of the nice thing about working in the community that you're from. You recognize some of the patients when they come into the hospital. You know them, you know their family. So seeing them in the hospital isn't necessarily the best thing, but there's already that connection. And so being able to move that forward and maintain that connection through a therapeutic relationship was something that I always wanted to do. Nice. So after getting the experience at the bedside in the NICU, peds, and cardiology, I decided I wanted to become an NP and have a little bit more independence and move away from the 12-hour shifts. And I'm sure everyone's heard about the state of our healthcare system and nurses in general. So it is tough. Bedside nurses, shout out to them all because it's not easy.
Right.
Okay.
You say tough, and I mean, it must, I guess, for you and, but I mean, like you said, you don't really want to see somebody you know necessarily at the hospital. But I could imagine me walking into the hospital and recognizing a nurse that, I probably see every day, or at least in a neighborhood, right? I would feel that level of comfort to come to you, right? So I guess it probably makes it that much easier for you when knowing the patient already, right?
Yeah, it does make it easier because like I said, there's already that connection. And I think they do feel a little bit more comfortable talking to you, telling you things that they might not tell another nurse or tell the physician that is in charge of their care. So it's, especially you're already in a more vulnerable state, you're sick for whatever reason, you're in the hospital. So having someone that you recognize is really nice, which is why, again, I love working I've always worked in the community in different ways. So it's really a benefit, and I really enjoy that.
Mm-hmm.
When it comes to the clinic, I don't work in my community, unfortunately, not yet. But I still work in Toronto, and when the clients come in repeatedly, you get to know them. And even if you don't, like, you can hear, oh, there's a Caribbean accent there. I know you. I know the kinds of foods you eat. We can connect over that. And it makes just conversation easier. And I think that they feel more comfortable. Yeah, okay, well, I had a few drinks. You know, it's the holidays, or, you know, I had a little bit of sugar on my plantain. You know, it's the kind of conversation. It's just easier to have when you have something common with your clients. And if you don't, you look for that commonality any way that you can, which makes it better.
Yeah. I was going to ask if you find that there's an underlying bias somehow, but you kind of expressed that. You didn't use the word bias, but yeah, that's, you know, it's commonality, and I like that you use that word instead of bias.
Yeah, it's because I think you can find something in common with almost everyone, right? Whether it's really cold outside, yeah, I know I hate the cold too. Winter's not my friend. Or, you know, there's some people who really enjoy picking their pimples. Like, you know, it might be that, or it might be, you know, someone who has like a real advice, like, I don't smoke, but you can understand. Like, for me, Cinnabon, love Cinnabon. Should you be eating Cinnabon every day? Not so much, right? So there's always something that you can connect on if you listen to what it is that they're telling you. So it's just about listening, I think.
I love Cinnabons.
I had them at my wedding.
Yeah.
Sure, whatever. But Cinnabon had to have it.
Great example. But it's so true. Mm-hmm.
Yeah. So what's your everyday like? I mean, you said you couldn't have the patience to be a teacher, but I would think you would need a hell lot of patience to deal with different type of people every day.
Mm-hmm.
Yeah, but it's a different kind of patience. I feel I did work as an instructor in some capacity with the city, which was different. It's only 1 hour, and there's several children. But as an NP, it's one-on-one. It's private, and the appointments can range from 15 minutes to an hour, depending on what you're coming in for.
Mm-hmm.
In terms of, it's listening to someone's story. So I don't have impatience listening to it. They're telling me something that's happening to them. They're not feeling well. They have symptoms, you know, started here, there, and I'm asking questions. Okay, how long has it been going on for? Does the pain radiate anywhere else? Does anything make it better, like lying down, heat pack, cold pack, Tylenol? Does anything make it worse? It's really a conversation, so it's not really about so much patience in terms of, it's a different kind of patience, working with kids and having a conversation, and patience in terms of, you know, this person's not feeling well, they're probably irritated. They come into the clinic to be assessed. It's sometimes there's a little bit of a wait time. I'm getting better, just a little bit of a wait time. And sometimes it's been ongoing for a while. And if you're in pain and someone's asking you all these questions, sometimes it's just one. Right? They just want you to give them a solution. But really, it's through those questions that, you know, details are released that help me help them. So it's just really working through it. Like, even if they don't want to answer the question, I can curve and ask a different question and hope gets a little bit more detail. So it's really an art of a conversation about how to get the information that you need to help this person as best you can. So it's very much so a different kind of patience. And, you know, when the solution arrives, for example, if we talk about diabetes, one of the best solutions is lifestyle modifications. So that's exercise, that's eating right. And I told you. So once you have that information, you do with it what you will. And it's, as much as I would love to see you healthy, it's still at the end of the day, it's your health, your choice, your body. So.
Right.
it's a team. You know, I can't do these things for you. You have to do them for yourself. And
How do you convince a reluctant patient though? Like, so someone that reluctant in the sense that they're kind of in denial and they're not forthcoming with information, and you know that, you know, based on their medical results from like blood works, you're saying, okay, I see this in their blood, and then they need to take this medication, but they're saying, no, 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 I'm fine. No, I'm not going to take this. Like, how do you manage with something like that?
so you can't convince someone to do something they don't want to do. What I typically do is, if that's the case, I would show them, I would explain to them, this is what this means. This is what I'm seeing on your blood work. You don't want to take the medication? Sure, okay. These are the alternatives. There's always, not always, in most cases, there are pharmacological interventions as well as non-pharmacological interventions. For example, traditional Chinese medicine, Ayurveda. There are options like that that people can pursue, and if that's what they want, totally, that's their choice. I will support their choice. But it's also about when they come back, for example, in 3 months to have that repeat blood work, and it still says the same thing or worse. It's more so, okay, have this conversation. This is what your blood works, and I'll show it to them. I'll show them their blood work. The same, you and I were looking at the same screen, and sometimes you can have access to your own blood work on apps like. I think all the hospitals have different apps, and I know Life Labs has their app too. But you can look at your blood work, and I'll talk to you about it, and I'll tell you the consequences of this number getting higher, this number getting lower, and we talk about what you want to do. If you want to continue with what you've been doing and try, some people who have, I'll use diabetes as an example because it is a chronic condition. Some people have made changes without medication. Great. Lifestyle, diet, exercise, perfect, great, good for them. For some people, that doesn't work. So it's just about finding what works for them and not necessarily convincing them. It has to come from within. It's just, again, having the conversation. Okay, you don't want to do X, Y, Z. These are your other options. You don't want to do those. Okay. We can continue to monitor and see what the options that you do choose, if they work, if they don't work, and then you can make a decision at a later date. It's not nothing is necessarily set in stone, not always.
Okay. So I just want to remind the audience that they are welcome to ask questions. They are watching live on Facebook. They're watching live on Instagram right now. We're live on VStreams. And feel free to make comments, ask questions. I see one on the screen right now. And we are watching Dissect live on TDN Network and YouTube and Facebook. So here's a question from someone in the audience. How do you feel about treating and not being able to cure or heal when you see people in pain?
Oh, there's different levels to that, I think. It depends on the type of pain. If it's acute pain, someone broke their arm, you might not be able to instantly treat it, but I mean, you go to people will go to the hospital, they'll get a cast, do some rehab maybe. And then there's chronic pain. People with fibromyalgia or osteoporosis, osteoarthritis, they're always in pain. So I do my best in terms of suggesting the things that they should be doing. For example, taking Tylenol or Advil. If it's indicated for some people, they should not be taking Advil. Sending them to physio if I can, getting it covered if I can. Connecting them to all kinds of resources. That's another reason why I am so grateful for my experience with the city, because I'm able to gear them towards something that's a little bit more affordable in terms of fitness. But if it's something like palliative care, that's a little harder. I don't have any patients who are currently palliative. I have seen when I was in the hospital, I did see a child pass, which was tough. But chronic pain is difficult. Patients usually find things that work for them as you work through them. How do I feel about it? I like if I can help, and if I can't help, I'll send them to a specialist, and hopefully that specialist will be able to help. And if I can't help in that way, I'm always there if they need to talk or just like, book an appointment to have someone to, I'm going through this, I'm going through that. Sometimes that's all that people need is just someone to talk to.
Right. You're absolutely right. Someone to just help take the pain away, almost, just have that conversation so someone understands or someone hears that they're going through it. Through your studies, so like go back and going back to your study time or study days, did you ever study about like other countries and what their medical systems are like? The reason why I'm asking is because we do have a wide audience base tonight, and our audience is spread out through the US, into the Caribbean, and not everyone is as fortunate as we are in Canada to have the OHIP system, right? Of the medical system that we can just show our card and get that medical treatment. Were you exposed to any of that through your studies?
No, they focus mostly on the Canadian system because that's what it's geared towards. They want their students to work in the Canadian system. However, the reality is that some of my peers did go to the States to practice nursing, travel nursing, or as an NP. You make more in the States. There's no covering that up, but so no, they don't really focus on other countries. I have my own personal experience in other countries where it is privatized and you pay for the care that you receive, and even in those situations, it can be like you're lining up to see a doctor, whereas here you would never line up. You would wait in a waiting room, or in your room if you're in the hospital, and the doctor usually will come and see you, or at least go to the nursing station and read your chart. But in some countries, even if you have like an IV or a blood transfuse, like an IV dripping, you're waiting outside this doctor's office in line to see the doctor, and if you leave your spot in line, that you have to wait again. So unfortunately, no, don't have much experience with other healthcare systems. I know ours isn't perfect. Not everything is covered by OHIP.
Right.
But it is better, I guess, than having to pay outright for everything. Like if you need an urgent surgery and they're like, oh, you got to go to your bank first, or you got to put down a credit card first. I can't imagine having to choose between your financial health and your physical health, which is the reality in some other countries.
Absolutely. I was just in a third world country. Although sometimes it doesn't appear to be third world country. I was just in Jamaica, and I was just talking to some people about medical health, and some people had medical conditions that they needed to address. And I found out that the University of the West Indies, located in Jamaica, they are actually doing some surgeries free of charge. I don't know if it's all medical surgeries that they're covering, but in that particular island, they are offering free services. So I'm just curious. I don't know, Novelist, if you know of anything in Dominica. When I go to Trinidad, I will find out something about Trinidad as well, because those are the closest ties to me. But yeah,
that's really interesting and could be really helpful.
Yeah,
but that must be devastating as a nurse. I mean, like, our system over here, even though we do complain about it sometimes, I think we have a better system than most countries in the world. So that must be devastating as a nurse to, like, go to a third world country and see people lining up, to see a medical doctor, when back home, like you said, we're sitting in the room, or whatever the case may be, right?
Yeah, and then having to choose your medication. Let's say there's 2 different kinds of medication, but you can afford the quote-unquote more efficient one or the better one, so you have to settle for another one that probably, sometimes depending on your comorbidities, might not be the best for you, but that's the only one you can afford. To me, that's just outlandish. We are very blessed here.
Yeah.
We do better, yes. I think our system is more reactive than proactive, and we need to switch to a more proactive system. That way, it lessens the burden on the hospital system. So that's why you have like family health teams, NP-led clinics, other primary care providers, and if we switch to that, I think that would really affect the hospitals.
Nice.
So we have a comment here. I don't know, novelist. I just want to read this one. Sometimes the job can be so, I guess, hard on a person. So do you get time for yourself? Do you get time for yourself?
Ooh, yeah. So I think I'm a new NP. I haven't quite mastered that art yet. And it is an art in the sense that you have to be able to put it down, because if you don't take care of yourself, you can't take care of others. I'm trying. I'm trying to make time for myself. It doesn't always work, because if the work doesn't get done, it waits there. Like, so if there's a referral that needs to be sent, I have to send it, because if I wait 1, 2, 3, 4 days, that's just adding to the length of time that the person is waiting to see said specialist, and waiting for specialists already can take months. So I try not to put things off. I try to get things done as fast as I can, just for the benefit of my patients. But I'm learning, like, when time's done, time is done. Things will get done, and I'll do something here and there if I can, or make notes on the side to make things more efficient for myself. So I'm trying. Long story short, but yeah, I'm trying to make some time for me.
That's a great question. Yeah, that was a great question.
I'm hoping there's this, like, well, I'm just going off my head here, that there's some type of system for you guys, maybe for, I don't know, massages, or even sit and talk to someone. Like, you guys do a lot.
It's interesting you say that. I think that the CPSO, so that's the Canadian Physicians, the Ontario College of Physicians, so they have something where their residents, I believe, and I could be wrong, I'm not an MD, so I don't know too much about that. But when their residents are doing their residency, that they have to enroll in some kind of mental health program to keep them, I guess, to prevent them from burnout. But again, not 100% sure. They don't have that for nurses.
I thought you guys had that.
Like with your workplace, but then it's more so being cognizant and actually using them. I had benefits when I was in the hospital, and so many of my colleagues were like, "Oh yeah, I didn't use them." So the entire year would go by and nobody would go get a massage, because you're just tired. You want to go home after your 12-hour shift. So it's just about making time to use the benefits that you do have. And if you don't have them, I think just for me, I mean, I do have benefits, but I think I just need time to decompress and take a day and do absolutely nothing, if that's what I want to do. So.
Nice.
Yeah, I'm sure you do.
I'm trying.
You need to, and I, again, like I said, thanks for asking that question. I appreciate that question. So I have a list of different things that I know of from my knowledge that affect us as a community, like diabetes and sickle cell, low blood cell count. Something I just learned, I was watching CNN. There was a CNN reporter who was talking very openly about her cancer, breast cancer. And she said that Black women, I don't know if you've ever heard this before, that Black women are 40% more likely to have breast cancer than any other race. So I just wanted to talk about the things that we as a people are more susceptible to, and maybe give us, if you can, some pointers of things that we can do to prevent or treat some of these ailments or diseases that we're susceptible to.
Yeah, so I think screenings are important if we're talking about cancer. So Black men are also more prone to prostate cancer. So having that conversation with your primary care provider about whether or not you should have PSA testing, which is your prostate cancer screening. It's not always necessary, so that's why it's a conversation you should have with your primary care provider. Mammograms, they recently changed the rules to screening for women who are 40. It used to be 50, but now you can go and get a mammogram. Or if you have a family history of cancer, you can get a mammogram earlier. So it's just being aware of the things like your family issues and being proactive and saying, okay, I have a family history of breast cancer. This was the age of the diagnosis. Or if you don't know, even if you don't know the age of diagnosis, if you know, grandma had breast cancer, you are more likely to have breast cancer. So going to get that screening at the appropriate time frame. I mean, if you're 18, that's too young. But going to get that screening, to eating healthy, it's really everything that happens at home, outside of the clinic, outside of the hospitals, being mindful about what you're eating. As a community, we're more prone to diabetes, and that is because of a whole bunch of factors, including socioeconomic factors. So really it's obesity. So if you have obesity, the more likely you are to have diabetes. So being aware of that, eating healthy, less fatty foods, cholesterol lowering foods, because that can also affect your heart and and diabetes and kidney function. Everything is so intertwined. Our bodies are made magnificently in the way that they function. So everything is quite connected. So for cancer, go and get screenings. For diabetes, make sure you're eating healthy. Make sure if you Google the Harvard Healthy Plate, that's how your plate should look. That is 1/2 should be vegetables, 1/4 should be protein, and the other 1/4 should be starches. So that can be any kind of, it can be rice, it can be yam, it can be, your vegetables can be anything under the sun. So that for diabetes. Another thing that we are prone to is sickle cell, that is hereditary. So being aware of your genes, I guess. If mom and dad both had sickle cell, they're both carriers. Your child genetic testing might be helpful when you are trying to plan for a family. Or if you don't know that you have sickle cell, no, you probably know. Sometimes you get pain crises. So unless you're a carrier. So just being aware of your health, having those, going for your appointments at least once a year to get some blood work done. If you go to an NP-led clinic like mine, you have a dietitian. You can speak to the dietitian if you need to about the things that you are eating, things that you should probably increase in your diet. But yeah, so I think diabetes is probably number one in our community. So exercising 3 to 5 times a week, getting your heart rate up. So some people will come in and tell me, yeah, I walk a lot at home. Doesn't count. You have to get your heart rate up because it's about heart health, just as much as it is about your intake and your sugar intake. So exercising, and then eating healthy, which can be hard given the state of the economy and the price of food. But vegetables, you can meal plan, and sometimes it's harder. People have lives and difficulties outside of just So, but I think if you have a partner or someone that you can, even if you don't have a partner, sitting down and being intentional about it, making a plan and trying to stick to it, you're going to fail sometimes. That's okay. It's about getting up and trying again and again and again until you develop a habit, right?
Mm-hmm. Great advice. Thank you so much. I wrote down the Harvard Healthy Plate. Is that what you called it?
Yeah. So Harvard Health Plate. If you Google it, it'll come out. And it's a really nice drawing of a plate and how your portion should be divided up. Mm-hmm. So most of it should be vegetables, fruits and vegetables, but also being mindful. Some fruit have more sugar than others. For example, I love pineapple. I love mango. But the sugar content in both of those fruits are quite high. Mm-hmm. So apples versus cantaloupe. Well, there's a recall, so maybe honey melon. So in your food wisely, you can still have pineapple. You can still have mango. Just how much are you having?
Right.
And be mindful of what you're eating.
But then we're told all these fruits are healthy for us to eat, though.
They are. They have great vitamins and stuff, and they have fiber. But some have a little bit higher sugar. So they're still healthy. It's just
Just
too much.
excess. Yeah.
Right.
So I want to just not to touch too much on that. We're talking about cancer, and you said 18 would be too young for a female to check for breast cancer. I know for men, they tell us at age 40 when, we should check for prostate cancer. So what would be, well, two questions. What would be the age that you think a woman should start, you know, going in for those for examination? And can a man go younger than waiting for age 40?
I think if you're having symptoms for men, so for example, if you're having blood in your urine, that is not normal. Go see your doctor straight away.
Right.
If you are having difficulty urinating, so whether that is maintaining a stream, whether that is waking up several times overnight to go to the bathroom, as you get older, yes, some of that can be normal, but it's not typical, especially if you're getting up, let's say, 12, 20 times a night. That's quite often. Or if you feel the urge to urinate, but you're not able to urinate, those are all those symptoms that should prompt you to go see your provider. So about going earlier, if you're aware of your body functions, like if you know, like, oh, this is not typical for me, that's when you should probably start to have a conversation with your
Mhm.
so, further testing.
Right. Nice.
Yeah. I like that question. And I find that people like men in our community, Black community, they're not they're reluctant to go and get this checked out because they have this misconception of what happens and what the procedure is like. And maybe things were different in one era, but now I think technology has been so far away advanced that they don't need to check the way that they used to check. And maybe people have heard horror stories, but our men are not going as often as they need to be going. And unfortunately, these are the cases where they end up at stage 4 and they don't even know. They're not aware. So what do you say to your younger patients? How do you encourage them?
So I haven't had a client who's been younger and I've kind of like grown up with quite yet. But to my younger male clients, I said, if you have any, I give them my card. Say, if you have any questions, if you want someone to talk, anything, come in. But I'm really hoping that developing that relationship with your provider, which is, I think the benefit of being an NP is that we have a little bit more bedside experience sometimes than maybe physicians. I'm not hating on physicians. Physicians are great, essential part of our healthcare system. I feel like I might have a bit more time to sit down and speak with a client and really try and get to know them. So I'm hoping that developing that relationship with my client, therapeutic relationship with my clients, will bring them in, will create a trust so that if they are having any symptoms, that they don't feel any type of way about coming in and telling me, like, hey, I'm not peeing quite right, or I've got this, I've got like a third lump, I've got a lump around my testicles, because that's what it means. It's just facts, right? If we're just talking about health, there's nothing attached to it. So I think that's the approach that men should probably take when it's just health. There's nothing else attached to it. Go in, take care of yourself. And then you can have a conversation with your provider about the kind of testing that you might need. For example, colonoscopy. Do you need one? Maybe you don't. Maybe you just need to do what's called a fit test, where the government public health will send you a kit to your house. You take a little sample of your poop and you send it back to the government and the lab, and they will test it. Sometimes it's as easy as that. So having that conversation with your healthcare provider to make sure you're getting the kind of care that you're entitled to is the most important part.
Mm-hmm. Okay.
I think for a lot of men, it's the trust factor, and excuse me, the medication that comes with it too, right? Like, you don't really know what medication you're gonna get. You don't know what you're walking into, but there's that fear of just I guess, a doctor giving you the wrong medication or just, things going bad. I think that's what it is for men.
I think that's where people have to advocate for themselves. And I think as someone who has a medical background or nursing experience is advocating. So I ask my doctor questions all the time. Why am I getting this? What's this for? And when people come to me sometimes with a list of questions, and they're like, "I'm so sorry, I'm asking." No, you are entitled to ask these questions.
Right.
You should be asking these questions. I'm
Yeah.
going to start you on atorvastatin, so it's for high cholesterol.
Mhm.
Okay, how does it work? What are the side effects? How long do I need to be on this medication forever? Ask the questions that come to your mind. Doesn't matter how silly you might think they are, you are entitled to have answers to your questions because you're the one who's going to be taking this medication. It's affecting your health. So advocate for yourself. It's so sad to see when people come in and they're like, I'm taking this medication. Okay, your specialist put you on that. Why did they put you on it? No,
No idea.
medication. I wouldn't say that I'm a very trusting person. I want to know everything. Give me the details. So I think people need to take that approach and really advocate for themselves. Don't apologize. Ask those questions. You're entitled to know the answers.
Mm-hmm. I'm one who does research on the medication. I want to know what the side effects are.
Mm-hmm.
And yeah, I'm like that. I will question it for sure. I like the fact you can advocate for yourself. So, men, if you're watching, advocate for yourself. Just ask questions. Don't be afraid. Maybe if you had a beautiful nurse like Kavita, you wouldn't be afraid to go in for your prostate testing. So.
Yeah, then he'll be more intimidated to ask questions.
No, but then a lot of what I hear from men is like, I don't want no man touching me. So then maybe you want a female doing the examination, right? So you don't always get a choice in the matter, but think health first, health and longevity first.
Right.
So yeah. Let's see if there's any questions from the back. Ladies, yes. So a little comment came in from the back. Ladies, encourage your men. And I'm one who does encourage my husband to do things. And he goes to the doctor more often than I do. So
wow, I'm impressed.
Yeah. So we do as women, we need to be the ones sometimes pushing our partners to do things. And we need to encourage them. Let's just not just allow them to say, no, I'm not going. If there's something wrong, we can't continue to just give you some bush tea and remedy it. Garlic tea and, some herbs will not always fix everything.
I mean, even like for me, I'm big on not taking medication, right? But if I feel something is wrong with me, I would like to know what it is. So at least I'll go to the doctor and find out what it is. So maybe I'll say no to, I don't know, the antibiotics or whatever. But what else can I use more natural to help me? So that's another option we have. Like, I got headaches. I will not take Tylenol. I'm sorry. I gotta have a toothache to take
First
one of
thing,
those things.
I am a wimp. I can't. Tylenol all the way.
No, I can't. But just finding out and finding another way to take care of it, that also helps as well, right? So
Mhm. I'm big on naturopathic ways as well. But then there comes a time when you really need to suck it up, buttercup, and find that MP and say, you know what, I need something for this. It's beyond just I'm going to do some herbal medication to fix this problem. There was a comment. Someone was asking you a direct question. Do you think that later on you might go into a different profession, maybe a medical doctor? Or
Oh God. My God, my mom would love it if I did. I don't know. NP school was hard. It was very hard. It was challenging in both good and not so great ways. I did go to a predominantly white institution and fought tooth and nail for representation. So my faith in teaching, the teaching institutions, medical schools and whatnot is not so great. And my interest right now is no. I just finished my program not too long ago. I'm content with who I work with, the way I work, what I do. And I don't really see the need for me to go back to medical school. I like being a primary care provider, so I don't want to specialize in, let's say, well, I used to want to be a pediatrician, but I see kids in my clinic all the time, and I don't really want to do any specialization, but never say never. So right now, no, I enjoy what I do, where I work and who I work with. So no, and the world needs more NPs. Sorry.
Yes, they do. They definitely do. I think that nurse practitioners are far more wiser, more knowledgeable about a wide range of different areas than physicians, personally. And you can prescribe. So why go back to school anyways when you can prescribe just as a doctor can prescribe medication?
Yeah, exactly. So I'm not about to put myself through debt and stress for something to move past something I currently enjoy. So no plans. And I agree with Chris. I think in my experience, at least, again, physicians are an important part of the healthcare system. There's no denying that. I think based on what I said previously, being more proactive versus reactive, we need more primary care providers like nurse practitioners to help the community take care of themselves to avoid the hospital, right? So, yeah, NPs.
Would you encourage more younger people to join the nursing program? Like,
oh yeah, 100%. Right now, the field is dominated by females. So guys, if you want to become a nurse practitioner, go to nursing school, go to NP school. A severe need for male practitioners. And I think nursing in any aspect of nursing, whether that is bedside or in a clinic as an NP, it's very satisfying. You get to interact with people who do all kinds of things, who are working in different fields, who are from different countries, have different backgrounds, different experiences, and you get to sample a little bit of all of that as you go. So I think it's a great field to be in, and it's a growing field. The state of our healthcare system is not so great, but it's constantly changing. So right now is the best time to get in. If you don't want to stay in, primary care or at the bedside, you can always go into cosmetics if you want to work from home, or you can work for a pharmaceutical company. I know there's a nurse, not an acquaintance, I guess, a friend of a friend who is working for a pharmaceutical company. She's a nurse. So there's so many different things you can do, and those skills are transferable to anything. So I would definitely encourage nursing.
Yeah.
Nice.
There was a comment from DD, and she was just kind of sharing with us that she knows someone that was diagnosed at the age of 39 with prostate cancer, and prophylactic measure taken by his
PCP.
So, yeah, definitely before the age of 39, it can happen. And this is why we encourage the men and women to continuously check yourselves, go in for those yearly physicals. If you see, like as Nurse Kavita said, if you see something wrong, you feel something different, don't wait. Go check it out.
And people say sometimes is not, which is, I said, like, it's a conversation you need to have with your primary care provider. You might not need your PSA to be checked. So that's also important to know. It's a conversation to have about the risk factors that you have yourself, as well as familial, to just other risk factors that you might have. That's why it's important to have that conversation with your primary care provider, because you might not need your PSA checked, or you might need it. So I think in Dee Dee's case, she said that the person was diagnosed with prostate cancer as a result of the family or the primary care provider doing prophylaxis, so trying to get ahead of it. But it's a conversation, which is why it's important to know these things like PSA. It's not mandatory, but it's a conversation you should have with your primary care provider versus mammograms. And nothing is mandatory, but you should at least have a conversation with your primary care provider, right? Just to figure out your risks and everything.
Something that I know for a fact that because I work in our community, and a lot of people do not even have primary caregivers. They go to the walk-in clinic. They don't have someone that they have a relationship with. If something goes wrong, they just go into the walk-in clinic, and that's not a primary caregiver.
No.
That's not someone that's going to care about you in that sense.
Yeah,
so
very
we need to get better. We need to do better in that sense as well.
It's hard to find a primary care provider. We had someone come into the clinic from Guelph to see an NP because there was just no primary care providers. But there's the NP-led clinic, and we're in Toronto. There's another one in Scarborough. There are family health teams. It can be a very long process in finding a family care provider, but I feel like once you find one that you really connect with or that you feel comfortable with, it's so important to maintain that therapeutic relationship with them. That way, if something does go wrong, you already have someone who's going to follow up and kind of coordinate your care. So if you see a lot of specialists, their office usually sometimes will remind you, hey, you have an appointment. Well, at least my medical admin is fantastic. So shout out to her. She will remind them of their specialist appointment. I will get the notes. I will review the notes when they come back to me. Okay, you saw so-and-so. This is what they said. How do you feel about that? What are we doing? Like, how are we going to move forward? What do you want to do? So this person is really like the coordinator of your care, works with you to coordinate your care based on what you want to see, your health goals. So having that family care, that primary care provider is so important because, like you said, Jewel, going into a walk-in it's not a good long-term solution, because then what about family planning, right? You decide you want to have a baby. You need a primary care provider because they're going to follow you through your pregnancy and then maybe send you to a gynecologist, but then the gynecologist might deal with your delivery because of the way it works at hospitals. They might be present for your delivery, they might not. And then you get discharged. And then where do you go? Who follows up with your child, your baby, your newborn? And you might have postpartum, you might just, and then you have the vaccinations for the child and whatnot. So you need a primary care provider.
So question here, and then Novelist, I don't know if you have anything else, but we do have the quick hitters. We have a question here. Is there a shortage of MDs right now? Do you know?
There's a shortage of, from my understanding, there's a shortage of primary care MDs. They would rather work where they are compensated more, or sometimes they're not paid enough from the government for their overhead if they're working in a private clinic. So yes, there is a shortage of MDs, but that's linked to a bigger problem in terms of getting in, like the actual seats in medical school versus the States. They have, like, you throw a coin and you'll hit a medical school, but here there's only like what, 6, 10? I think 6, something like that.
Ryerson's opening one as well. So
in Brampton, which is fantastic. I really hope they focus on the community in Brampton because they only have a hospital.
Right.
Hopefully that works out for Brampton as a community. Fingers crossed. But still, even that, it's not going to solve the issue. That's where nurse practitioners can come in. We work with MDs, primary care providers, to kind of fill that shortage, but there's not enough of us either. So if you're in a nursing program now and you're interested in becoming an NP, totally go for it. But I think that the comment is not incorrect. Yes, there is a shortage.
Okay.
Nice.
Well, lots of heavy information here.
Heavy and
Lovely. Yes.
Definitely. Well, I don't have any more questions.
Except for our quick hitter questions.
Right? So, yeah, except for quick hitter questions, that is. So, yeah, I don't think anybody else have any other questions unless you guys want to give them a minute or so. But we can get straight into the quick hitters and have some fun. And I'm pretty sure you want to get, all the medical stuff in the back of your mind for a second. And
This is a good question, actually. Does being a nurse impact your love life?
This is a very interesting question. I think my husband would say so. When you are a bedside nurse, you're working 12-hour shifts. I don't think most hospitals do 8 hours anymore. But anyways, for the most part, 12-hour shifts. And you rotate between night shifts and day shifts. So, and depending on the kind of schedule, you might do 2 weeks of nights and then 2 weeks of days and then so on and so forth. Or you'll do 2 nights, 2 days, with a few days off in between. And that doesn't mesh well with a 9 to 5, right? 9 to 5, 9 o'clock, you're already gone. You're already starting, like, for me, I was already on my first feed, like feeding my first baby when I was working in the NICU. 9 o'clock, first feed's already done. I've already taken reports. I've already, set myself up for the day. I'm feeding a baby. I probably got another one. And then 5, I'm still at the hospital. I come home, finish at maybe 7:30. By the time I get home, 8 o'clock, you eat, you bathe, you get ready for the next day. Go to bed. That's it, So it
cuddle. I mean, that's.
Don't leave me be.
You get a little cuddle time.
Wow. You're tired. Your bed is calling your name. I am stressed. There's always work drama too. So yes, it can. I think it's about being intentional. I'm a planner myself. I like to know what's coming ahead. I have a schedule and everything, time-wise, where, when, how long. So I think planning ahead is really important for love life.
And social life.
And social life. Yes. Jewel can attest to this. Like if there's no plan, it's likely I will not come.
Right.
Wow. Well,
good question from the audience. So quick hitters, let's get to it. Maybe we have one of those kind of embedded questions.
Would you
3 for 3?
Would you like me to go first? 3 for 3. 3 for 3. You want to go first? I'll go first.
All right. Do you have a celebrity crush?
Celebrity crush. First person that comes to mind is, oh God, I don't even know his name.
Star Trek.
The originals. He acted as Klaus. I think he was married to. I don't know his name.
Is that a movie? The Originals?
The Originals. It's a spin-off of The Vampire Diary. Oh my God.
Okay. I thought it was something from Star Trek. It had to be one of those.
Okay. Of course, I am not a Trekkie.
Okay. A person you'd trade places with for a day.
No one. Kind of. That's weird. No. Like. I don't think I would. Or Beyonce. Maybe Beyonce. But she works real hard. So I don't know. Well, maybe one of like those super rich Dubai
divas.
Yeah, sure, whatever. Where I can get a day of luxury and not do anything, I will switch.
Okay. Guilty pleasure. Cinnamons.
Cinnamon, yeah.
That was easy. Yeah. She answered all of mine. Let's see if she answers yours.
Okay. The biggest risk you ever took?
Oh, the biggest risk. Oh, that's an interesting question. I don't know.
It popped into your head, but you let it go.
Right?
I feel like marriage is a risk.
I was gonna say this is what I was gonna. That's why I said it. It was there. You let it go. You went shift.
I think marriage is a risk, but it can pay out in the end. Well, throughout the years, you hope. So
yeah.
Okay. Something that would make you laugh the hardest.
Oh gosh. Laugh the hardest. I really like it's kind of mean. There's a video of a bigger child in a roller coaster with his friend Nancy or someone, and he's just crying on the roller coaster. That makes me laugh all the time. I feel really bad about it.
I actually love this. Okay. Yeah. We all have this one. The worst advice you have ever gotten.
Worst advice I've ever gotten. Is not to tell my mom. Not tell your mom. That's pretty bad advice.
Yeah.
Yeah. So anything that ends with that is bad advice.
True.
All right.
All right. You did well.
Thank you. Yeah, I think I warmed up in that.
And I want to say thank you to our executive producer for supporting us in coming up with some of these questions because we were struggling. Thank you, Sam. Thank you.
We actually been playing this game for
over a year.
And tonight, well, I guess you're the test of it all, and then we got some proper questions to ask. So
turned out pretty. You were our guinea pig.
Yeah,
okay.
I didn't want to use that word. Okay, so. But yeah, you did good, and yeah, you did good overall. It was nice having you. It was a nice show, very informative, and yeah, thank you for joining us tonight. I hope you had fun with us, and I hope all the you got relaxed and all that stuff.
I did. And this person whose comment, Yvonne Glory, thank you so much. She said she was proud of me, and I was like, oh, thank you.
It's my mom. It's my mom. My mom is a retired nurse, and that's my mom. And she hasn't tuned into many episodes, but because she heard the nurse was coming on.
Aw.
Nice.
Yeah.
Your mom's awesome. Oh, well, I can't promise that.
No more parties for us.
You know what? I agree. I'll leave it at that.
Novelists don't get involved. This is just.
I'll leave it at that.
Anyway, it was nice having you. Not only are you my friend, you're an intelligent woman who is going to do extremely well in your profession. I can see this already. And if you need a nurse practitioner, I will be sending you to Kavita's clinic. Hit me up on our Instagram on Dissect, and you can get through to her. Dale says thanks for coming and answering questions.
Thanks for having me, guys.
Thank you.
Yes.
So, very interesting. I like this type of shows, and we needed something like that.
Mm-hmm.
We needed something like that. I mean, we entertain you guys every week with the artists and whatever else, and this was needed. Very informative, and we should do something like that again for sure.
Yeah, we have something up our sleeves.
Yeah, always have stuff up our sleeves. I got no sleeves, but
thank you, Didi.
Yeah, thank you, Didi. Thank you everybody for joining and interacting with us. Hope you guys got a lot of information from that. And man, yeah, please, we need to do better.
Mm-hmm.
If not for ourselves, for our partners or kids or family, right? So definitely do better. Like I said, I'm not into medication, but at least find out what's going on.
Yes. And for our next week's show,
Mm-hmm.
Jonelle, Miss Grippy. She will be on next week. She's a soca artist from Trinidad, and things are expanding and exploding for this carnival season in most Caribbean islands, Dominica, Trinidad. I know even in Panama they have carnival. So
yeah,
we have her. She's going to be entertaining us with her experience. So don't forget to tune in to our show next week. Same time, same place. Follow and like and share. Instagram, Dissect, and Facebook and YouTube.
Yeah.
TDN TV.
Sayonara, folks. All right. I'm Novelist.
And I am Jewel.
You guys have a blessed week and a blessed weekend, and we'll see you guys next Saturday. Deuces.
Peace.
So I'm Janine Zabi across. I'm Janelle Zabi. And where's Zabi Street?
So this is what you need on the inside and we're ready to
Are you, Jewel? I think you have hidden talents that you're not talking about.
Let's get to the bar. Ain't no bar, Mr. Drum.
Yeah.